Our PC team is the only party with the stability and experience to heal our healthcare system and keep us on the road to recovery. And our PC team is the only party fighting for more consumer choice for Manitobans. I'd now like to welcome James Teitsma, our PC candidate for Radisson, to the podium to talk about how we're expanding primary care options for Manitobans.
Thanks so much, Lauren, and good morning to everyone here. It's great to be with you all right here in Radisson, my constituency today. I'm James Teitsma, and I'm a very busy dad with 6 children. And I want to talk about some of these exciting changes that our PC party believes will greatly improve healthcare for families right here in Manitoba. These changes are about making healthcare more accessible, more convenient, and more efficient for parents and their children. Right now, when one of my kids gets sick with something minor like strep throat, it often means a trip to the doctor's office, and then a visit to the lab for tests, and then finally a stop at a pharmacy like this one for their antibiotics. It's time-consuming and somewhat inconvenient, and it can delay the care that our kids need while putting unnecessary pressure on the health system. So the Manitoba PCs want to take that pressure off the system where we can and when we can. That's why a re-elected PC government is committed today to expanding primary care services at our local pharmacists. Pharmacists are professionals. They're well trained. They're well educated. They are highly capable of treating common conditions. And pharmacists and pharmacies play an important role in our everyday health. But to some extent, they're also underused in our healthcare system, and we think that should change. Under a re-elected PC government, pharmacists will play a bigger role in healthcare by allowing them to treat common conditions like strep throat, pink eye, minor skin infections, tick bites, sprains and strains, and by managing chronic illnesses, chronic diseases like high blood pressure and diabetes. This will mean less waiting, less hassle, and more convenience for you and for your families. We want to streamline healthcare and make it more accessible for all Manitobans. We think this is a simple solution to a common problem, and that it will save Manitobans time and money and the stress of navigating our healthcare system. These changes are essential for better healthcare for our families, less running around, and more time for what really matters. Supporting a re-elected PC government will make these changes happen. And let's make Manitoba's healthcare system work better for all parents. Our kids deserve it. So do we. Thank you.
Thanks, James. I'd now like to welcome Darren Murphy, CEO of Northway Pharmacy and Board President of Pharmacists of Manitoba, to the podium.
Thank you, Lauren. Good morning. I'd like to start by acknowledging that we are located on Treaty 1 land, the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, and on the homeland of the Red River Métis. We honor the treaties that were made on these territories and acknowledge the harms and mistakes of the past. Pharmacists Manitoba also appreciates the important role that traditional medicines have had for Indigenous people in health and healing, and hope to work with all communities with respect for traditions and cultural backgrounds. As mentioned, my name is Darren Murphy. I am the CEO of Northway Pharmacy, and I'd like to welcome everyone this morning to Northway Pharmacy Harborview. This is one of 11 locally owned Northway locations in our province. I am also president of Pharmacists Manitoba, the membership and advocacy association for community pharmacists in our province. As well, I have been a licensed pharmacist in our province for 16 years and am now one of nearly 1,200 licensed practicing pharmacists in community settings within our province. On behalf of the Pharmacists Manitoba Board of Directors and our members, I am incredibly pleased to see this commitment today to bring the scope of pharmacy practice in Manitoba to the level found in other provinces across Canada. Pharmacies in our province account for 460 point-of-care sites located in over 90 communities, and community pharmacists are the most accessible healthcare professionals. Pharmacists played a key role in helping the government of Manitoba respond to the COVID-19 pandemic and continue to be a trusted healthcare provider to many Manitobans. This past spring, 2023, the University of Manitoba College of Pharmacy graduated its inaugural class of Doctor of Pharmacy professionals. With this in mind, it is extremely important that the next government of Manitoba work with Pharmacists Manitoba to advance the pharmacy profession. Working collaboratively to better utilize our profession will not only help us retain pharmacy graduates in our province, but also help ensure Manitobans can access care that is timely, appropriate, easy, and equitable, even for those living in marginalized communities or those who live in rural and remote areas of our province. Pharmacists are alternative care providers with the skills, education, and ability to help alleviate the health human resource crisis by sharing the workload with our physician and nursing colleagues so that Manitobans can receive the right care at the right time in the right place. Modernizing what we can offer in line with pharmacy practice research and the real-world learning from other provinces will better serve Manitobans. Whether it is a so-called minor ailment, which never feels that minor when it happens to you, or managing chronic health conditions like high blood pressure and diabetes, your community pharmacist is ready and eager to do more to help support your health and wellness at a time and place that is convenient to you. We are very accessible, but I don't want that to overshadow the incredible skills and knowledge that pharmacists bring to the table. Our profession is ready to play a larger role in creating a healthier Manitoba. Thank you.
Thanks, Darren. I'd now like to welcome a local pharmacist, Nyan Arnold, to the podium to bring some remarks.
Good morning, everyone. I appreciate the opportunity to speak today in response to this exciting announcement. I am a community pharmacist here at Northway Pharmacy, Harborview, and I have been a licensed pharmacist since 2017. Expanded scope and remuneration for clinical services administered by pharmacists will make healthcare for my patients more accessible and allow myself and my colleagues to contribute to the healthcare system in an even more meaningful way. As a pharmacist, I want to add value to our community. I want to be able to help the patient that would otherwise not be able to access care within a timely manner. I graduated from the University of Manitoba College of Pharmacy with my certificate in prescribing for minor ailments, and I'm ready to utilize my skills and training in order to practice to my full potential. I'm proud to welcome this change and challenge, and I know many of my colleagues within the pharmacy profession are ready to do the same. We have been asking for these changes for years, and we are ready to get to work. Thank you.
Great, thank you both for your comments of support on this exciting announcement. I'd now like to open up the floor to questions from the meeting.